Well, hello. I guess we had some interruption with our audio, so we decided that we would just record this and then Blake will put it up on the YouTube afterwards. I'm Dr. Ella Thorpe with Tustin Longevity Center here in Tustin, California, Southern California. We do this weekly at 9:45 in the morning, where we try to take questions from our patient base or their family and friends. We are allopathic standard trained physicians with a large amount of experience over many decades in integrative alternative medicine. So we'll entertain any question you have. Hopefully we'll have a good answer, or maybe we have a ability to follow up next week after we look into your question, because I may not have all the answers. The other thing is this is not meant to be personal medical advice. These are general question responses and not to be construed as personal advice for your personal care. We are taking new patients. We have 5 physicians here, and we'd be very happy to see you. So as far as today, we'll start with probably some questions. I know you can email them in, and the email they should email a question into, Blake, is to
office@tlcdoctors.com.
office@tlcdoctors.com, office@tlcdoctors.com. And typically when we're live, you can put it into the chat, but at least for right now, you can email your questions. And I do think we have a few maybe I can try and answer for this week.
Yeah, one was someone, P.A. Patel here at the office, posted a video about vitamin D consumption, and a question in the comment was, why would I need to take vitamin D supplements if I'm out in the sun getting vitamin D from the sun?
Well, the answer to a question, why should I take vitamin D supplementation if I'm out in the sun, and she understands that the sun ultraviolet light on the skin is involved in converting components in your skin into vitamin D, and the answer is it's just not happening anymore as was thought. I have been practicing medicine about 40 years now. I even have young men who are lifeguards in Newport Beach, California, and when I test their serum vitamin D levels, they are low. What is low? Well, I think anything that is below 60 is low. And they might have a 25 or a 35 range. But in the research, especially, for instance, regarding the COVID concerns of the virus, they're finding vitamin D levels that are at least at the 50 range seem to be associated with a much improved outcome. So we certainly don't want our patients much lower than 60. So we like them roughly between 60 and 100. Now, why would the sun not be doing that? Well, one of the things that is argued is that there are chemtrails, these exhaust lines that you see, these fake clouds and lines in the sky. These exhaust clouds have nanoparticulate metals in them, like zinc oxide, strontium oxide, barium oxide, and these various nanoparticulate metals. I don't think it's zinc oxide, I think it's strontium, barium, and maybe another, but these then are reflecting back the sun's ultraviolet light in a argument that they are trying to prevent warming of the planet. So chemtrails are tiny particulate nanomaterials that are redirecting that ultraviolet light back out into space, so less is hitting your skin. And that would probably be one understanding. Number 2 is vitamin D is a fat-soluble vitamin, more behaving like a hormone, and it is attracted to fat tissue. And since we have an obesity problem in the United States, a lot of the vitamin D that you may have is actually going into your fat cells and really not accessible at the time of need. So there are many reasons why you do need supplementation, and I have seen this in my clinical practice for many decades now. So hopefully that answers that question.
Yep.
Do we have another one, Blake?
Yeah, just one more. They were curious if a keto diet, they had heard in the past that it can contribute to kidney and liver issues if you do it for a long term.
Well, I think anyone who is going to do a keto diet should be under the care of their physician. And long-term, we're talking probably in the terms of months worth as opposed to weeks worth. We know that a very low carbohydrate diet, which is a keto diet, that puts your metabolism into a fat-burning metabolism mode as opposed to a carbohydrate metabolizing mode, will then produce fatty acid breakdown products, and those are called ketones. This is well established in your biochemistry. This is not foreign to your body. We are designed to be able to handle this type of metabolism for many weeks, maybe even months. As far as doing this beyond the course of a month's time, I think I would ask a physician to be testing you to check your serum insulin level, your serum glucose level. I have never seen any kidney or liver damage ever in the decades and decades I have been preaching a low-carb diet. In the 1990s, I was out there putting my patients on a low-carb diet. So all this keto craze and stuff is very old news to me, and I've been helping people for decades. So I've never seen it. I would probably suggest that people who have had any reference to any kidney or liver issues are not drinking enough water, because Americans typically don't drink enough water. And I would say that unless I looked into and looked for any research on this, my clinical experience of working full-time for 40 years, at least of which the last 30 to 28 years have been with a very low-carb keto diet, I've never seen any problems with kidney or liver issues. But I would certainly have a doctor look over you if you're going to embark on that, especially if you're a diabetic. There are certain medical conditions that probably should be watched closely, and being a diabetic is one of them.
Great. That's all we have so far.
Well, I want to bring up, talking about the keto diet, remember on the last video we did of December, I was embarking on a 5-day fast where I didn't eat any food. I only had water for 5 days. I did that from December 31st until January 5th. So I went 5 days again. I do this every year as a cleansing from the holiday seasons. And then in the course of that time, I lost about 11 pounds. And my urine for ketone testing, which I tested, it takes a woman about 3 days to get into full ketosis. We have less muscle mass than men as a typical general rule. Men can get into good ketosis in about 2 days because they have more muscle mass to burn glucose down. What I found was it takes pretty much women 3 days to get there, and you're looking at the keto strips. You can go to your drugstore and ask for a keto jar of test strips. When you urinate, you dip your the tip of the keto strip into your urine, and you look at a color code, and as the strip turns pink and rose and then dark rose and then red to purple, you are getting more and more ketones in your urine. So it's going to take you probably day 2 before you see it turn to pink, and then day 3 you'll see it probably flip to a dark rose or even a purple color. So I stayed in ketosis all the way through day 3, and then on after my fast ended from just water, that would have been Tuesday the 5th. I did have a meal that day. I used our Drs Nutrition Bar. These Drs Nutrition Bar is what I proposed to use, 1 bar twice a day, and that is in fact just what I did. One of the things about this bar was we did the human studies, clinical studies here, and we tested the blood, the actual serum levels for blood sugar after eating it, and we were about 22 times less of a sugar spike than your top selling keto bars, protein bars. and our insulin stimulation from this was about at least 5 times less stimulating on the insulin. So we have our clinical studies. And I stayed in ketosis, eating 1 bar twice a day. Then I decided to add in the evening a salad. And the salad moved me out of the dark red, large to moderately large ketosis into moderate to mild. And there I've been staying ever since. I eat 2 bars a day and I have 1 small salad. The salad is very simplistic. I only put romaine lettuce in it, and I use a tablespoon of dressing. I am using, to be totally honest, a Caesar dressing, and I put some sprinkles of Parmesan cheese on it, and it's a bowl about the size of my hands. And I was able then to have regular bowel movements, because there's 15 grams of fiber in each bar. So if you have 2 bars a day, you're getting the total recommended amount of fiber every day. For a woman, that's 30 grams. The other thing is, you will find if you do the ketosis fasting, as I did, your mental clarity and your endurance is superior. I worked all the 5 days that we had fasted for, December 31st through January 5th. I kept up with my personal trainer 3 times a week. So my mental clarity and focus and acuity, as we find on many of these, we looked at other aspects. We found that the hunger pretty much passes after day 2. And then if you take this bar, it will satiate your hunger for a prolonged period of time. The energy, the sense of endurance is enhanced with this bar. We had, again, increased mental clarity, and we had, the statement that they would recommend it to others. So our P factor for probability was 0.01, and our serum studies on the glucose being so very minimally budged after eating it, and the insulin was such a low budge, that P factor was 0.01. So we know indeed that we are putting into this bar fats that are so very important to the repair of the cell membrane. One of the things I like to point out is the picture I'll always show my patients of the double layer of the cell membrane and damage from free radical oxidative damage. These fats have to be repaired. These blobs here you see are protein receptors, and essentially this bar is chock full of the phospholipids that make up your cell membranes of all your cells, and the fibers that are prebiotics as well to help you have a healthy gut, and protein. So 15 grams of protein in a bar, 15 grams of fiber in a bar, and we've proved that it's 4 net carbs. So that's an update on myself, on how I did and am still doing. I'm doing the rest of this whole month just with 2 bars a day, and I did add the small salad in the evening. I finish eating at 5:30, and I have my bar about 1 o'clock. So I'm roughly on a 20-hour fast every day, and I eat between 1:30 and 5:30. So I think that'll be it for today, and we'll see you next week, hopefully Wednesday at 9:45 in the morning, and then we'll go from there and take your questions, send them in to office@tlcdoctors.com. Is that the website? Send in your questions, and I wish you a happy day and week. Until then.